been asked to help run a clinical trial.
No. What, do you want a reason? Clinical trials take time. Your time is my time.
I lost my parents when I was 6, but it gets easier. Your heart's healthy.
Looks like she builds her own furniture.
Built her own furniture. Built her own furniture at 16. When I was 16, I was only concerned with 3 things: food, sleep, and lubricating hand cream. Very excited to be reacting to House MD Season 5, Episode 8, Emancipation, recommended by our first ever channel member, Joseph Randomness. Thank you for your support. Let's see if I can get the diagnosis before House does as a doctor working in London. On this channel, we are reacting to all 177 House episodes, and this will be episode 36. No time to waste.
Paolo is the one who got you off the night shift.
Not like I asked.
Oh my days, can we just take a moment to appreciate the increase in production value here? They've hired out an entire factory just to shoot this scene and keep us on the edge of our seats. Commitment. Now she's foaming at the mouth, she appears conscious, her lungs are filling up with what seems to be serous fluid. Her being a factory worker must be contributing, although we're not quite sure at this point what kind of factory she's working in. Could she have been exposed to asbestos? Probably not. Usually mesothelioma would present much later in life. Another thing that doesn't seem too accurate is that her actual lungs were filling up with fluid rather than the chest cavity that compresses the lungs. Are they trying to get at pulmonary hemorrhage here? In that case, vasculitis like Wagner's or Strauss could cause it. Could also have a clotting disturbance due to heavy metal poisoning. Could be an atypical like dengue fever, CMV, hantavirus, or simply influenza. She could have inhaled toxic dust of something called trimellitic anhydride, which is a component of plastic and epoxy resin, which lead to diffuse alveolar hemorrhage. Would fit that she's a factory worker and the pulmonary hemorrhage component. Excited to find out more about this one.
16-year-old girl with fluid in her lungs. Gram stain was negative, no bacteria, no pneumonia. Her parents died last year, no relatives.
Check her home and work for toxins or drugs. Cutner and Foreman, do an echo. Find the extent of the heart damage.
Interesting, a lot to go through here. So Cutner's saying that she declined having sex regularly or having a risky lifestyle, and the others are saying that they need to test for it anyway. In reality, if what she's saying is true, she shouldn't mind doing the test. We usually do pregnancy tests on all women presenting acutely. You see, the worst thing you can do is find out that someone's pregnant after you've done a CT scan or an X-ray, seeing the babies there in the image. By that point, it's way too late as you've already irradiated the poor fetus, increasing their risk of birth defects. Another radiology image you should never see is a tension pneumothorax on a chest X-ray, as that means you haven't examined the patient properly. Other interesting points raised is Taub said she could have picked up a parasite from a co-worker. A bit of a misplaced statement, as we wouldn't even remotely begin to think parasites here at this early point. Does that mean that it's a parasitic infection? If it were, then Entamoeba histolytica, Echinococcus, or Paragonimus could have caused that. Although it likely wouldn't be serious, it would be more of a pussy effusion. So they could see that on microscopy as well when they took a sample. They also mentioned that she's had no previous trauma, lung or cardiac issues. One thing though is that her parents died and she has no relatives, so maybe there could be a family history or genetic component here. We'll see.
I've been asked to help run a clinical trial.
No. What, do you want a reason? Clinical trials take time. Your time is my time.
I lost my parents when I was 6, but it gets easier. Your heart's healthy.
Looks like she builds her own furniture.
Built her own furniture. Built her own furniture at 16. When I was 16, I was only concerned with 3 things: food, sleep, and lubricating hand cream. Could her building her own furniture expose her to toxic wood finish containing formaldehyde? Maybe she inhaled the fumes and that led to systemic effects of the poison. Could also lead to the pulmonary hemorrhage, nausea, vomiting. Could lead to GI bleeding from the urine, and yellow discoloration of the skin as well. Interesting character development here as well. We find out that Cutner can relate to the patient as he was orphaned at just 6 years old through such a difficult time, and all the marijuana he smoked in Harold and Kumar. Also, House seems to be worried about empty nest syndrome and feels if he lets go of Foreman to go get involved with other teams, he might leave for good, especially since he has gone before as well. The truth is though, just like a controlling parent on their kids, tightening the reins just pushes them further away. Relationships should be based on reciprocity and mutual respect rather than rank or superiority. Many problems arise from having overly vertical relationships based on authority and power. To give you a very good example of this, there was an occasion when not one but two surgeons, Roberts and Gold, actually removed a Korean War veteran's incorrect kidney even after a medical student had told them that they were doing that, and she was told to be quiet because of the fact that she's a medical student, and that sadly resulted in the patient passing away. It's just as the African proverb says, a wise man never knows all, only fools know everything.
If you're this grown up at 16, what happened at 30?
Turn back into a kid, like Kuttner.
Kuttner's not that bad.
He needs everything to be nice. And trust should be earned.
Drugs could have caused intermittent tachycardia.
I'm so glad this point has been raised, as I've had a very personal experience with this. One of my parents recently suffered from some palpitations, which is the feeling that your heart is beating. They went to see their GP with this and they said, okay, we'll organize an ECG trace of the heart and some blood tests to see what's going on. They came back normal and they said, okay, that's it, there's no problem. We've ruled anything dangerous out. Well, first of all, you ruled out any problem at the time the ECG was taken, which is not when my parent was actually having their palpitations. It's just a snapshot. So I had to push for them to get a 24-hour tape, which measures the heart over a longer period. Should be routine procedure, but that's why it's very important having an advocate who can push for things, as sometimes healthcare organizations do make mistakes and look over certain things. I've definitely made mistakes myself in the past. So a 24-hour tape or a stress echo could be the next step here. It could reveal she has ischemic heart disease due to familial hypercholesterolemia, and that's why her parents died so young. But the question is for you smart people, what percentage of adults over 20 have high cholesterol? Drop your answers down below.
Foreman, starter on beta blockers.
A bond belongs to my ex. It's why he's ex.
The other possibility is you have vasculitis. The treatment for that is steroids.
They could kill you.
Interesting, so right now the team is stuck between arrhythmia and vasculitis, even though there are no antibodies on the blood test. Seems like the girl is denying drug use and Kuttner wants to start the steroids, but what they've said is if she did do drug use and she's lying about it, then that's really bad news. In reality, that wouldn't quite be the case, but it definitely makes for interesting television. Is Kuttner going to give the beta blockers or the steroids? Let's find out.
Haven't used drugs.
I'll get the steroids.
If you want to prove you can do his job and something more.
His puke is red. That's blood, right?
Yes, it's just getting worse.
Oh, this is Foreman's chance to hit back at House. Well done, Cuddy. So the young patient is vomiting blood. That's all we seem to know so far. Obviously, it was given to Foreman as a challenge, so it's not going to be something common like gastroenteritis. Patient looks about 4 or 5 years old. Could be a Meckel's diverticulum, polyp, giardia, Crohn's disease. Would definitely want to do a stool test for fecal calprotectin, which are the inflammatory markers of the bowel. Over system parasites in the stool, and a full set of blood tests, and then decide about an MRI small bowel after that, as long as he hasn't ingested a spoon or something like that. Now, if you're enjoying this video and want to help me improve the content, then check out the channel membership. Not only does it help me a lot, but it also gives you access to some exclusive perks, like being able to suggest a series and episode for me to react to, and getting early access to new videos. The first 30 members will get access to a chance on winning a one-on-one tutor session with me on any medical topic of your choice. We already have 10 members, so there's only 20 spots left. So make sure to secure your place now before it's too late. The earlier you join, also the earlier I can react to your suggestions. So press join now.
Get the hell away from me! Dad, don't! Get your hands off of me!
Beta blockers don't cause psychotic breaks.
She's not on beta blockers.
You treated her based on empathetic orphan syndrome.
And that's what happens when you trust a teenager who tells you that they're not taking drugs. Although in reality that would make no difference to how she reacted to the steroids, to be fair. Steroid side effects can be profound, including weight loss, thin skin, muscle weakness, rapid mood swings, acne and psychosis, as we've seen. The treatment would simply be withdrawing the steroids and she would improve. Alternative treatments that could be first line easily are immunosuppressants like cyclophosphamide, methotrexate, mycophenolate, or monoclonal antibodies like rituximab, although you have to be careful with reactivation of TB with monoclonals, as that's the last thing that she needs right now.
She wasn't on steroids long enough for it to cause the delirium.
Prinzmetal angina. No reason it couldn't cause an artery in the brain to spasm. Leads to the delirium and the pulmonary edema.
Run an fMRI to see which artery's dancing.
Oh, very interesting diagnosis. Prinzmetal angina is usually caused by vasospasm of the coronary arteries with an unclear reason. It leads to symptoms of a heart attack that resolve with no trace of the cause afterwards. Foreman is suggesting that there is spasm in the brain, and House wants to recreate it using a drug called ergonovine or ergometrin. It's actually a drug that's used primarily to induce contractions of the uterus or the vessel walls through a mix of fight or flight receptors. House wants to capture that with a functional MRI, which actually has a very interesting history. Functional MRI was developed in 1982, just 15 years after the first MRI scan was done. Before MRI, they needed to do nuclear magnetic resonance techniques, which were way more expensive and produced a less good quality photo. The groundwork for MRI technologies was attributed for Peter Mansfield, who actually failed his 11+ exams and left school early. Science teachers said that he would never have a career in science and amount to nothing. Talk about a motivating speech. He got back into school, went on to do a physics degree, and then experimented his first prototype on himself. He was unsure if his heart would actually stop. He was later given the 2003 Nobel Prize for Medicine due to the discovery. You see, even when things go badly, there's always hope.
It's really a camera?
I need you to swallow this pill.
What's happening?
I don't know. I need a differential for uncontrollable giggling.
Interesting, so the pill Foreman gave Jonah is what we call a capsule endoscopy. We tend to use it if we think there's a problem in the small bowel that we wouldn't be able to reach with a top or a tail camera. An MRI small bowel is usually a better first line investigation since you can see more at once. The capsule also doesn't tend to stick around if it sees an abnormality, and earlier capsules have only one camera, but with new ones there is a 360-degree view available. Pretty cool if you ask me. So what could cause this kid's giggling, bloody vomiting and diarrhea? He could have hemolytic uremic syndrome leading to delirium and giggling. If he has gastroenteritis with E. coli 0157, which is the most virulent strain, would definitely want blood tests including his urea, electrolytes, and to keep him well hydrated if he's not keeping anything down. Loving this dual case episode, they're always the best.
How'd you find out about your parents?
State trooper.
Look at that. Your parents aren't dead, are they?
I got emancipated because my dad raped me.
What? That's terrible to hear. But sexual assault is surprisingly common. Did you know that 1 in 6 women in the US have been a victim of attempted or completed rape in their lifetimes? Sadly, this number is also rising, with 90% of cases involving alcohol, whether by the perpetrator or the victim. There is actually significant evidence that if alcohol were discovered today, it would be banned. It actually causes more population harm than heroin or crack cocaine, and the only reason why it's legal is because it has been historically. Efforts to ban it, like prohibition in the US, actually ended up causing harm as alcohol went underground with unlicensed brewers and deregulation leading to toxic products. Really tough problems to get around without an easy fix.
Rape could mean STD.
Could be lying about the rape.
Severe emotional stress can lead to asymmetric function in the midbrain. And load her up on diazepam.
Stomach cancer, myomyosarcoma.
Altered mental status means porphyria is more likely, and we test for both.
What is going on? Foreman's hiding his other case from House and getting Cameron and Chase to do his work for him. Chase suggested a differential which would have been found on the endoscopy. If there's a stomach cancer that they didn't see when putting a camera into the stomach, then I don't know what to believe anymore. That being said, I do really like the double meaning of this episode named Emancipation, as Foreman is trying to break out of House's circle to leave the nest and spread his own diagnostic wings. Now with the other patient, they've done the worst thing they possibly could do and said it's all in her head. If she did have severe stress, they would have seen an overactive amygdala, which is the fear and anger center of the brain, on fMRI anyways. But seems like nope, they can do a lie detector test, but nothing else. I don't think this is stress related, and this could still be related to the diagnosis I said at the start, formaldehyde poisoning. Very interesting. Let's see where this goes. Fun fact, the amygdala of a first-time mother has actually grown 4 times compared to her pre-pregnant state.
Stress wouldn't change your urine color.
What does her furniture look like? Holes means it was pressure treated. Sawing or burning it releases arsenic into the air and into her lungs.
Oh, House picked up on the homemade furniture as well. Now, arsenic poisoning is usually caused by drinking contaminated water, as arsenic in the ground can leach its way into the water supply. The timescales here don't quite fit the symptoms, as the onset would be 30 to 60 minutes after exposure, and she was at work when it happened, which we clearly saw. Longer term effects are possible from subacute exposure, but they wouldn't cause catastrophic fall on the factory line kind of symptoms. Arsenic combines with something called sulfhydryl groups in the body's enzymes that are involved in cellular metabolism, and that disrupts normal bodily processes. That's how it causes damage, leading to nausea, vomiting, diarrhea, intense thirst, and dehydration. You can most reliably test for arsenic poisoning using a urine test, and the treatment would be with chelation. So let's see how that goes.
No cancer, no porphyria.
Help!
Some cardiac arrest. Nothing. Go again.
Clear.
He's back.
Calculation's complete. You're arsenic free.
Nothing like a sneaky defibrillation to shock your audience. What shocks me though is how many times they shock a non-shockable rhythm. There are 4 cardiac arrest rhythms. 2 shockable, 2 non-shockable. Flatline, asystole, non-shockable. The other is PEA. It looks like the heart should be pumping blood as normal, but it's not. Non-shockable. Then there's pulsus VT and VF shockable rhythms. I wonder now, since Foreman is having to go to House for help, if the team would have to go to arsenic poisoning girls' parents as well to complete the juxtaposition. What an episode.
Need 4 milligrams lorazepam! This is her brain today.
Lesions.
Magical lesions which appear out of nowhere.
She was cured, and she wasn't. Put the arsenic back.
No freaking way. This is absolutely crazy. Must be a parasite. Arsenic is used as a treatment for trypanosomiasis, such as African sleeping sickness and Chagas disease. The drug milazepam, which treats them, actually contains arsenic, although it also causes lethal encephalitis in 5% of patients. And guess what they use to try and reduce the possibility of that? Steroids, which our patient is clearly not able to have because of a little psychotic breakdown. Talk about a catch-22. To be fair, as an alternative, arsenic does also treat some cancers, like acute promyelocytic leukemia is the classic one. Although would a cancer come back that quickly? Very unlikely. This has to be one of the most intricate episodes diagnostically ever.
Acute promyelocytic leukemia is still treated with arsenic, and she's gonna need a bone marrow transplant.
The best match would be a sibling or a parent.
Biopsy a lesion and load her up with arsenic.
Oh, did I just get that? Oh, I was quite late though. Does it count? Let me know down below. Also, House has been learning over the last few seasons. You see, season 1 House would have said, we don't have time for tests. Give her the arsenic now. Well done, House. You've made your legal team proud. Now the question is, how on earth is she gonna get her bone marrow transplant from her abusive parents? Props to the writers for coming up with this one. Either accept the marrow from your abusive parents and live, or die by your pride. What would you do?
Biopsy confirmed APL. She needs a bone marrow transplant.
This doctor says you have leukemia.
Sophia Isabel Velez?
Do you know something I don't?
Just that liars lie.
Whoa, this episode is something else. Our patient has now lied about being an orphan, about her name. What else has she lied about? Maybe she isn't in the country legally, and she actually crossed the border using someone else's identity. Also, how would she be funding all of this expensive treatment? Surely she wouldn't have health insurance through her work, or would she? Would be very interested to know from anyone with health insurance in the US. Now, give us the truth.
An iron overdose.
From his vitamins.
I only give him one.
Not more make him strong.
She's lying about being raped?
Wouldn't be here first.
Iron overdose from children's multivitamins. From children's multivitamins. Okay, let's work that out. So the minimum toxic dose for iron is 20 milligrams per kilo. And this child looks, let's say, around 20 kilos, which means the toxic dose would be 400 milligrams minimum. The lethal dose is actually 3 times that, so that's a conservative number. Now, the average children's multivitamin with iron has 6 milligrams of iron per tablet, which mean that he would need 66 tablets to reach the toxic threshold. That's more than 2 whole packs of gummy vitamins. Surely she would notice. That would also take a very long time to consume. Although I saw my 6-year-old nephew in a Brazilian carvery the other day, and he ate about as much as me, so not inconceivable. Probably not possible though, but very fun to watch.
She lied about one trauma to cover a worse trauma.
What's worse than rape?
You see someone who did something terrible, who doesn't deserve to live.
I killed my brother.
I've seen 35 episodes of House. Wife cheats on husband with best friend. House killing one baby to try and save another. A father who poisons his son with a radioactive necklace. I thought nothing could surprise me. Yet here I am, as surprised as a nudist in Antarctica. Here's a question for you smart people. What percentage of homicides are carried out by females? Answer down below.
I was supposed to watch him. He was in the bath.
If you don't take your parents' bone marrow, they'll be killing their other child.
Wow, so many of us carry secrets like that with a heavy toll. They may not be as heavy as this, but they certainly start to add up. Things like your dietary preferences, religion, choice of partner. We feel we have to keep some of these things secret because we worry about being judged. The truth is though, until we accept that we can't please everybody, it's impossible to be true to ourselves. Immanuel Kant, famous 18th century philosopher, describes that desire to please people as inclination. He compares it to a rock bouncing down a hill, changing direction with the tilt of the land until it becomes a smooth, round pebble. He says we have to rise above inclination if we're ever to be true to ourselves and be valued as us, not a version of us that feels separate to our true self. We may just be surprised at what people can accept, like this daughter now being reunited with her parents.
I want to do clinical trials. I can do this, and I'm doing it.
Okay.
Nice thing you did for Foreman.
Almost cost a 4-year-old his life.
Well, you knew Foreman would figure it out.
Did I?
Wow, how set up that case for Foreman. Incredible. I am loving this episode. Not only did House cure the first patient, but he managed to help Foreman get ready to see he can start diagnosing patients on his own. When Foreman went back to House, he actually refused to help him so he could push him to his limit. What an episode. 8.5 out of 10 for entertainment, 7 out of 10 for accuracy, 9 out of 10 for diagnosis. Thank you to our first ever channel member, Joseph Randomness, for the recommendation again. And huge shout out to Amarnath Pandey for winning the Bacterialist competition. The brain-eating organism you're thinking of is Naegleria fowleri, but that in fact is an amoeba. Well done either way. Now it's my turn to diagnose you. Seems like you've got a house reaction deficiency. Oh look, the cure's popping up right here. Go on, treat yourself. I'm Sarmed. Stay curious, stay sharp, my rocks.